Hi there, you're welcome to Dami Rx Care. My name is Abidemi Adamson, and you're welcome to our channel where we talk about medications and how to use them properly. So our medication for today is penicillin. So penicillin is a common antibiotic that is used for various treatment in patients. It's normally used in little children as well as adults as well. All right, so some of the dosage strength of penicillin, it comes in 250 milligram, 500 milligram, and it also comes in oral suspension such as 125 milligram and 250 milligram. All right, this antibiotic is used to cover bacteria such as E. coli, Staphylococcus, Streptococcus, as well as the Haemophilus influenza. All right, and it can also be used in other treatment of other bacteria as well, depending on what the doctor is trying to treat. All right, so the treatment of this medication is normally used in patients who have strep throat, patients who have bacterial endocarditis, as well as patients who may have other skin or skin structure infection. All right, so this medication is normally used for about 5 to 10 days and is usually used for every 6 to 8 hours. Sometimes it can be used every 12 hours as well, depending on what the treatment is. And the medication is supposed to help to stop the cell wall of the bacteria from the production of the cell wall. All right, so what are some of the adverse effects? So adverse effect of this medication includes nausea and vomiting. This is very common among young children who might find the odor of the suspension kind of nauseating, so they tend to vomit after taking the medication. And just being sick in general or having an infection may cause some nausea and vomiting, and you're not able to keep food in. So using the medication also can increase the chances of that. All right, another common side effect of this medication is diarrhea. So usually with any antibiotic, diarrhea is a common side effect. So you want to make sure that if you are having diarrhea, some medication you want to take with food, such as this. If you're having diarrhea with it, you may take it with food to kind of help reduce that diarrhea. All right, so another common side effect is hives, or patient may have a severe reaction to this medication known as an anaphylactic reaction, where your throat closes up, your face or mouth gets swollen, or the patient is not able to breathe normally. So usually when this happens, you would have to call 911 because the patient may be having a severe reaction to penicillin, and usually in this case the patient will no longer have to take penicillin because of the severe reaction that they have to it. All right, another common reaction to penicillin is itching or rash. So if this happens, you want to stop the medication and reach out to your doctor so they can put the patient on another medication to kind of help with the bacterial infection. All right, so what are some things that you need to know while taking penicillin? So first thing first, it's preferably taken on an empty stomach. So you want to take it 1 hour before you eat or about 2 hours after you eat. Like I said earlier, if this medication is causing consistent diarrhea, then usually they will recommend taking the medication with food to help reduce that diarrhea. Also, another thing is you want to take this medication at an even interval so as to be able to know and remember what time to take it. So if you're taking it every 6 to 8 hours, so you want to take the first one about 8 o'clock if you're starting at 8 a.m. in the morning. So the second one will be about 2 o'clock in the afternoon, and then the next one will be 8 p.m. at night. So you want to kind of space it out that way in even intervals so you can know and remember when to take this medication. Also, another thing about an antibiotic is you want to make sure that you completely take the whole treatment in order for it to help treat what it's supposed to treat. Also, with the suspension, you want to make sure that you're keeping the suspension refrigerated and make sure that you're discarding or trashing the medication after about 14 days, especially if it's mixed in with water. You don't want to take it past 14 days. All right, so another thing is if you're taking it as a suspension, you want to make sure you're shaking that suspension well and keeping it refrigerated, as I said earlier. If the diarrhea does become persistent, you want to make sure that you stop it. If it's a severe diarrhea, maybe you're not able to keep anything in, you want to make sure you stop the medication and reach out to your doctor in order to see if they can prescribe another antibiotic for the patient. A great thing about this medication is that it's safe in our pregnant patients, so they can prescribe it if the patient has like a bacterial infection. Also, another thing is that if the patient is on birth control, this medication may reduce the effectiveness of the birth control. So you want to make sure that while you're on this medication, that you're using another form of caution or contraceptive while you're on this medication. I hope this video was able to help you in terms of what to look out for while taking penicillin. If you have any further question or need any recommendation from our healthcare professional, be sure to check out our website at www.demyrxcare.com, and you can talk to our healthcare professional regarding this medication. We look forward to seeing more of you, and bye-bye for